how could a chiropractor help my sciatic or my herniated disc pain, let alone just your mild mechanical back pain? Because I think too many people out there want to put chiropractic in this bubble where it's like, oh yeah, it's like cracking your knuckles. Your spinal cord is not in your knuckles. Your spinal cord and brain is connected behind your spinal column, and that is where chiropractors work. And a chiropractor that adjusts mechanically correct and knows how to stimulate the nervous system, that is how we begin to mediate and mitigate and really reduce pain. Ligaments, mechanoreceptors, proprioceptive inputs to the brain, inhibiting nociceptive fibers at the level of the nervous system. Everybody, welcome back to the channel. This is Dr. Jonathan Pearlman, and today is a unique situation where I had a scheduled podcast. Studio time was ready, and somebody had a scheduling conflict, and I just had so much that I wanted to share in terms of what was supposed to be the importance of protein as we age, and I'm going to put that on the back burner. But I don't know if you had seen my Instagram post this morning, which was really in response to somebody referred me, a potential client or a potential patient who was in pain with some sciatic pain. And I didn't hear from that person, but in the same feed, and it's been a while since I've been on social media really looking at things like this, because I can get emotional or angry or it touches a chord in terms of my experience with chiropractic as a patient. And now as a provider, my experience continuing moving forward, noticing how often people will say, don't go to the chiropractor, they can't help you with a potential, we'll just call it a herniated disc. Again, my story is that somebody said, don't go to a chiropractor, they can't help you with a herniated disc. Had I listened to that person, had I listened to that piece of advice, I would have never gotten my life back. I would have never gotten out of the pain that I was in, and I would have never been able to bring chiropractic to my community now. And to call it a community is really an understatement, and beyond, because people drive from everywhere, fly from places. It's really quite incredible to get the type of Gonstead chiropractic that I guess you could say specialize in or offer, which is incredibly humbling, and it makes me feel really good. I can honestly say that with sometimes, yes, it definitely will build my ego or confidence, and I have no shame or no hesitancy saying that. But the reality of it is look, I've said this before. If you've listened to the last podcast I was invited on with Kevin Kuhn on Athlete Factors, and then again with him on my podcast, the Dr. Pearlman podcast, and the previous episode with Kat, I believe I said it as well. I don't heal everybody. Every other chiropractor out there and or other practitioner doing manual therapy who claims to get great results, they don't heal everybody. Okay? So now that you understand hopefully where I'm coming from, this idea of people telling you that a chiropractor can't fix a herniated disc or work on your sciatica alone, chiropractic affects sciatica and you need something else with it, that is so open-ended. I mean, really, who knows? And it depends. So I think we have to start at this place where not just everybody's situation is unique. But let's think about it like this. Why would somebody tell you that a chiropractor can't help a herniated disc or sciatic pain? Would it be because they themselves had a bad experience with someone they loved, or themselves have experienced that a chiropractor wasn't effective for the treatment based on their back pain or their sciatic pain or their referred leg pain or whatever? Or is it because their provider or their primary care provider or their orthopedic doctor or medical doctor or other person said, yeah, those chiropractors, they just don't do anything more than cracking a joint, much like cracking your knuckles. How's that going to help your nerve pain? And that's where I'd like to kind of start, because the question is, who is it going to work for and not work for? I think depends on like where you're coming from. One is, how fast are you expecting this intervention, this modality, this adjustment, right? This manipulative therapy, this cracking of the joint, how well are you expecting it to work? Based on what? One time, one adjustment, 2, 3, 4 adjustments, a full program and plan where then we're going away from just an adjustment to decompression, exercises, soft tissue, physical therapy, dry needling. It depends who's in front of you. Now at my office, where we just do adjustments and then recommended therapy, which is really no more than me spotting you and showing your body how to move appropriately, and then you doing that at home on your own, we create, or we take this passive modality, which is the adjustment. And when I say passive modality, I mean me as the provider or the practitioner doing it to you, the patient or the client. It is a passive modality. I passively am going to put your body through motion. You're going to have to find a way to relax. We're going to make the necessary adjustment. And then I'm going to show your body a position to be in, which will relieve or alleviate, at least temporarily, hopefully somewhat permanently, working towards permanently, of that pain you're in. And then it's up to you, the patient, to begin to embrace that and take those exercises or ideals or notions of what we've shown you to the house, apply them appropriately and turn that into an active, you, the patient, utilizing it as home exercise, active therapy, whether it's part of your body being in flexion or extension or lateral bending or rotation. This is all now getting a little bit too nuanced, but I want you to understand that active therapy of you doing it. So a lot of my patients, if you're listening to this, or clients I've worked with, if you're listening to this, if you do the bird dog, one hand forward and one leg back, if you do the cat-cow is another one I recommend oftentimes. If you're doing a lot of it where your back is flexed like the angry cat, or the belly goes down like the cow with the belly going down, you're progressing, through the motion to where you're beginning to accept extension tolerance through what was intolerance, or vice versa, flexion. And there's all these nuance in terms of how much lateral bending or rotation or stability we'll put in a muscle versus another muscle that might be turned off throughout these exercises. That's how complex it is in terms of understanding how to be able to build somebody back up after that passive modality has been given, i.e. the adjustment. Now, if somebody is still listening to this and you're wondering, well, again, but you maybe didn't explain how the chiropractic adjustment might work for the sciatic pain or the disc or the herniated disc, what you have to understand is this. I could show you 100 MRIs right now where everybody has a disc herniation. Let's just call all those 100 MRIs where there's a disc herniation, we'll call them a posterior lateral protruding disc nucleus pulposus, the jelly donut filling of the disc. At L5S1 is this example, pressing towards a nerve root, transversing nerve root on the disc, or sorry, excuse me, on the spinal column, or in the intervertebral foramen, is the way it would read in an MRI report. And that would be something that might be justified to say, oh, well, we have to use decompression, or we're going to use an injection, do a nerve block, or they'll try to, burn a nerve, or there's all these medical intervention procedures along with surgical or excluding surgical right now, but you can call the other ones I just mentioned very invasive. What you have to understand is those are costly, they're high risk, there's a lot more that's involved, and did it fix the problem? Well, here's the thing. The pain, based on the L5S1 disc example that I just gave you, about 50% of the people might actually experience pain on that same disc herniation that you see on MRI, and 50% of the people might experience no pain at all. Now, there are meta-analyses of lots of randomized controlled trials of compiled data of patients having disc herniations, and some present with like a 10 out of 10 pain and others present with a I don't feel that pain. So, adjusting that same level, regardless of the pain, not only does it crack the joint, forgive the expression, and increase motion in the joint, but it actually inhibits something called nociception. And it regulates this endorphin response in the brain. Endorphins are pain modulators within our nervous system. In other words, it feels good. It begins to inhibit the sensation of pain. That's what you want as a patient. Patient means to suffer. As a patient, you are suffering, you are in pain. What brings you into the office is finally the straw that breaks the camel's back oftentimes, right? i.e., why I'm making this video. Somebody's husband couldn't take it anymore. They needed intervention. They wanted someone to step in. Please help this raging sciatic pain because it's keeping me from being able to work. It's keeping me from being able to exercise. How we do that, as I was just talking about, is inhibiting those nociceptive pain fibers at the level of where we adjust. If you get the big enough, if you will, crack, which is really a pressure gradient changing, which should actually be more of a deep thud than an actual superficial ligamentous kind of pop or snap, you want this deep thud where the pressure gradient changes at the level of the disc and the facets and the IVF within the body. And even though that's a little bit more technical, the last couple of things I said about the IVF and the level of the disc and the facet, it's a little bit more technical in terms of people that are in like the health and wellness realm. If you're a massage therapist, if you're a physical therapist, if you're a kinesiologist, if you are a chiropractor, you understand that. But as a patient, what you have to understand is we want to reduce the amount of pressure that's been built up around the actual nerve itself that is supplying the area of where you feel pain. And the chiropractic adjustment, and as I always put the disclaimer, done biomechanically sound and correct, that is how it inhibits or silences that pain, stimulates those endorphins, and actually gives a chance for the proprioception, right? Awareness of oneself in space, led up to mechanoreceptor, right? Stimulatory mechanoreceptors packed within the ligaments and the tissues around the disc and around the spine. It is perceived by our higher order sensory input brain, and it says, wow, I can move better. I can now begin to tolerate through greater ranges of motion and proper biomechanics how I'm going to begin to heal. And that's the beauty of the chiropractic adjustment and why it works so well. Because you can begin to heal now that you have that increased range of motion in the simplest terms, on top of everything else that I just sprinkled upon the elaborate scientific more explanation. But that is how it works. And to be able to get that in as little as one session, but clearly you're going to need to work in patterns, you're going to need to work in we just said patterns, combinations of adjustments that complement each other. Now, Dr. Ian, who everybody has so famously seen on YouTube, his videos have been viral. So if you haven't seen Dr. Ian, his last name Rosenbaugh, I'm probably butchering it, on YouTube. But you go to Dr. Ian YouTube and you see a lot of these great, kind of miracle-looking adjustments. There's no miracle associated with it. It's all scientific, and I just explained how it works. So what it is if you can set, and this is why I'm saying Dr. Ian, he said this in a podcast. It was the 1505 podcast, I believe it's called, for Gonstead doctors, where they come in and they talk a lot about the Gonstead system of chiropractic and the type of care that we provide, and a lot of the nuanced science and sort of the management overall, how it kind of works, and our experience helping people since Clarence Gonstead put this into existence many years ago. Dr. Ian said, we are putting a dysfunctional segment back onto a functional segment. And to me, even though that is so brilliantly put and probably very true, I think about it as those combinations of adjustments or those patterns of adjustments in terms of the way, hey, if you have an L5-S1 disc herniation that is bothering the nerve root and making your lower back not just ache or have sharp stabbing pains, but also creating this sciatic pain or this burning pain that you might feel in your butt or your leg, well, what's going to happen if I reduce that pressure in that joint and inhibit some of those pain fibers and change that signal to the brain and increase biomechanics? Well, you could say that I've set a dysfunctional segment onto a functional one. But what I like to think of it as is removing the pressure from that joint in that intervertebral foramen, where the nerve is housed. And now that it's moving better, I have bought some time by restoring the proper biomechanics that now I can take that dysfunctional pelvis, that foundation, the ilium and sacrum, and I can set that dysfunctional pelvic segment back on towards that lumbar disc area. And that really ties in nicely to how Dr. Ian referred to it in the podcast, but how you can see where a combination of adjustments or multiple adjustments are warranted to kind of begin to piece you back together. And I saw that too, and the reason, again, I'm so motivated by this isn't just this morning where I was seeing people say, don't go to a chiropractor, chiropractors alone can't do it, you need acupuncture, and you need massage, and you need decompression. It's like, that might have been their experience, but have you been to the right, not just Gonstead chiropractor, but the right chiropractor who knew how to mechanically assess you and adjust you that day, and then work in these patterns and get you back to feeling better very quickly, and then be able to manage it? Because this past week in practice, there's 3 people that come to mind where we removed the pain, that initial pain that was so debilitating that they couldn't work a full day, they couldn't sit for more than an hour, and they couldn't sleep or get comfortable in bed. They couldn't get comfortable in bed, which was affecting their sleep. And we were able to get that under control very quickly, and then be able to, within 3 adjustments, get them to a very comfortable baseline to where they were able to exercise. And no, I don't mean running 5 miles outside or doing CrossFit, but actual stability exercises, strengthening their core and being able to now fire things like their gluteus maximus, their gluteus minimus, their actual piriformis muscles stretching out, utilizing their hip flexors appropriately, and actually begin to kind of build stability around the injury and take the brunt of the load off that back that was locking down that joint that was inflamed, creating pressure, causing the sciatic pain in the first place. So this monologue mini podcast is a Dr. Pearlman solo for the first time in, I think, since episode 3. And now, as you can see, I've brought on a lot of guests, and we really expand what we want to bring to you, because it's all about education, inspiring sometimes, right? But informing and educating you guys so that you understand where I'm coming from as a chiropractor and as a health provider, everything by natural means. So this video and this podcast isn't about, are you a candidate for surgery? But I really wanted to just bring up in sort of the simplest of terms, like, how could a chiropractor help my sciatic or my herniated disc pain, let alone just your mild mechanical back pain? Because I think too many people out there want to put chiropractic in this bubble where it's like, oh yeah, it's like cracking your knuckles. Your spinal cord is not in your knuckles. Your spinal cord and brain is connected behind your spinal column, and that is where chiropractors work. And a chiropractor that adjusts mechanically correct and knows how to stimulate the nervous system, and those that have been in my office and have been adjusted in that way and have felt that response, that is how we begin to mediate and mitigate and really reduce pain from all the other, within all the other scientific kind of things I talked about earlier in this session, where I mentioned ligaments, mechanoreceptors, proprioceptive inputs to the brain, inhibiting nociceptive fibers at the level of the nervous system. It's all incredibly complex. I mean, I will have guests on my podcast that are going to elaborate on this in the future, because a lot of my podcast content is really centered around eating healthy and creating an anti-inflammatory diet, nutrition, sustainability for life, how to do it the right way, exercising or purposeful exercise, right? Like we just had on with Kevin Kuhn, Athletes Factors. Guys, I mean, it's easy for me to sit here and tell you all day long about the wonders of chiropractic, but I think it's important, especially this morning, because, hey, I'm already happy with this, and we're about 20 minutes in, and we're going to cut it off here. So, you know, we had that cancellation. This opened up an opportunity for me to make this video, to put that content out there. Please go ahead and share this with people. Let them know that if they look at our videos or Gonstead videos, like I mentioned with Dr. Rahim, who is on YouTube, you can watch my Dr. Pearlman TV on YouTube. You could check out my stuff on Instagram, Dr. Pearlman TV Instagram. All the links are in the description below, guys. You see now just how, forget whether it's effective or not, because I just told you, I don't heal everyone. I don't fix everyone. No provider out there fixes everyone. There's too many individual factors to consider in terms of when, where, and how, and what else were treated within the same session, let alone over the course of a treatment plan. So the next time people ask you, can a chiropractor treat a herniated disc? The answer is yes. And hopefully somebody in your circle has had a good experience with a chiropractor where they can recommend that you get in there and get care, because the longer you put that off and the more that you're reliant on injections and Advil and pain pills and, God forbid, opioids and things of that nature at that strength, while the mechanical and nervous system issue has never had a chance to be corrected, you are being done a great disservice, and there is a lot of prolonged suffering that will continue. Guys, thank you for tuning in. If there's anything you ever need, you just put in a comment. If there's content you'd like to hear, just put it in a comment. Reach out to us on our email or through our website. Everything in the description. And until next time, everybody, it's Dr. Pearlman.